What factors of home oxygen therapy reduce the incidence of hospitalization related to hypercapnia in aged adults with COPD? Oxygen use in the COPD patient population is relatively safe, but the patient must be provided education on oxygen-related burns from smoking to avoid hospitalizations. As stated by Moore in the British Journal of Nursing on home oxygen therapy in patients with COPD, nurses should assess if the patient is able to handle oxygen safely and independently before advising home oxygen therapy. Pisani stated in Effects of High-Flow Nasal Cannulas in Patients with Persistent Hypercapnia after an Acute COPD Exacerbation that an alternative method to reduce hypercapnia is the use of high-flow nasal cannulas. Physiological short-term studies have shown that high-flow nasal cannulas can generate an acute reduction of PaCO2, even over a wide variation of baseline PaCO2 levels. When compared to non-invasive ventilation, high-flow nasal cannulas also demonstrated a similar reduction of inspiratory muscle effort compared to spontaneous breathing. High-flow nasal cannula therapy is reported to improve patient comfort, avoid mucosal dryness and injury, and deliver a more reliable and stable fraction of inspired oxygen. The main goal in oxygen therapy is to maintain sufficient oxygenation and avoid increasing PaCO2 levels. Too much oxygen too fast can lead to hypercapnia, which is the retention of CO2, which can then lead to respiratory acidosis. According to Trout, in a quality improvement initiative for COPD patients, a combination of diagnostic tests and appropriate use of non-invasive ventilation have been found to reduce the risk of further hospitalization as well as costs for those possible hospitalizations. These include PaCO2 and pulse oximetry monitoring, and proper teaching on how to use oxygen in the home setting.
There's going to be several interventions that nurses should think of when they have a patient that has COPD. Some of these interventions include monitoring and assessing to make sure that there's no adverse effects of the oxygenation prior to allowing home oxygen therapy to occur, making sure that the patient knows how to use a pulse oximeter and that they're either going to get one or already have one at home. Making sure that the patient is not going to have a decreased respiratory drive due to the oxygen therapy, and the nurse should make sure that the patient is receiving optimal oxygenation while they're at the hospital. So for the education, the provider or the nurse should make sure that the patient is receiving the proper education on how they can manage their chronic disease at home. This is done by assessing the patient's level of understanding, seeing how educated they are, and by using words that they will be familiar with. Kellett and Moore stated that patients with low literacy levels suffer from increased medical emergencies due to a lack of understanding on how to take care of their disease. This statement is important because it goes to show that education can really play a big factor in preventing future hospitalizations for the same disease. So something else that's important to consider when you have a patient that has COPD is to talk about smoking cessation. So according to Moore, about 1/5 of COPD patients continue to smoke even while they're on oxygen therapy. This can be really dangerous because if they're going to smoke and they have the oxygen turned on, it can really lead to injury or even death. So the smoke inhalation can also lead to an exacerbation of their COPD, and that could also lead to injuries and death. So something that can be done is risk assessment, and this would be done to prevent unsafe oxygen use in patients, such as smoking while on oxygen therapy. So an example of this is if a patient has a high risk for unsafe habits relating to home oxygen, then further education and time needs to be spent with this patient to prevent them from making these bad decisions and to make sure that they're not going to be hospitalized due to these bad decisions. Okay, and so finally we have collaboration. And collaboration can be between the nurses, the provider, and obviously the patient. And this leads to the patient having better results from their home oxygenation therapy. So collaboration could be as simple as having the provider and nurse demonstrate how to properly set up and use oxygen tanks. And it could also be, for example, them teaching the patient the do's and don'ts of the oxygen tanks and how they can take the oxygen tanks with them and still incorporate it into their daily life. So according to Hinkle and Cheever, another important collaboration would be that nurses should be working with the patient to educate them on the symptoms of hypercapnia and how to monitor their oxygen levels at home using a pulse oximeter. So to finish off the presentation, we basically are going to have a Kahoot, and that's going to be in the description box of this video. And it's just going to be going over the things that were on this presentation.